Hey, everybody.
Nice
How
to
you
see
doing?
you.
It's good to see you too.
Gotta say, love the pictures of your RV. Looks awesome.
I know, I love it, loving my RV, baby.
I
You
know,
know?
looks like you are. Good for you. How big is it?
It's a 37-foot trailer.
Smokes.
It's a nice size. It
That's
really is.
big.
Yeah. And
Good for you.
the nice area, my family's from up there, so it's great.
Good for you.
Pretty.
Hello, Representative Wood.
Hello, how is everybody?
Yeah, well,
Good, how are
good. And I'm
you?
trying to convince her to get her own to be up there in upstate.
I do have RV envy. I see them on the roads all the time and everyone looks like having so much fun.
Yeah. It's beautiful up there. It's great. Up in North River.
Charles, thanks for joining. Very nice to meet you.
Hey, Charlie.
Nice to meet you all as well. I appreciate the chance to be with you all today. And I also said I'm not in an RV somewhere with you, so.
We could move our Access Health Board meetings to the trailer. That would be fine. Everybody drive.
That sounds great.
Joe McDonough, blast from the past. How are you?
Thanks for joining, Joe.
Wonder, should I get my, Diane, should I get my screen ready or? Does people want me to wait?
Yeah, just wait. We're going to do introductions and then we're going to go over to you, Vicki. Vicki does have to jump off early, so I did ask that she go first. Please, I hope I didn't offend anyone by putting her at the beginning, but that is the reason why.
Thank you. I'm actually can stay on till 2. So if you need me, I can hang around.
Good. We'll give it another minute or so because I know other members of the committee are joining.
Hey, friends.
Hi, Representative Hughes. How are you?
Good. Good.
Hello, ladies. Excited about this. Running a minute late though for my last meeting, so just driving home.
Okay.
Not a problem, Lucy.
And Lucy has the pleasure of serving on both committees.
All right, why don't we just get started with introductions while people are joining. That should take a few minutes. Diane, let me know, give me a thumbs up if we're ready to go. Great. Welcome everyone to the Insurance and Real Estate and Human Service Joint Informational hearing here on the exchange. This is a really exciting time for people in Connecticut that may not have had the best coverage or expensive coverage or high deductible plans or no insurance that can now go on the exchange and have a lot of their premium payments subsidized or even pay zero for really good health insurance. So we just wanted to hear from the players that are involved with this and see where we could help or facilitate in any way. This is really their time that they're working the hardest with the open enrollment period coming to an end on August 15th. So we want to listen and see what we can do to fill in any gaps or help make things better. My name is Carrie Wood. I'm the state rep from the 29th district and co-chair of the Insurance Real Estate Committee. And at this point, I'm just looking to see who's here. I'll pass it over to Vice Chair Robin Comey.
Hi, everybody. Good to see everyone. I hope everyone's having a great summer, and I look forward to hearing what we're going to learn today. And thank you for all your work on this, Carrie and Diane and your guys' team. So I'm representing 102nd District down here on the shoreline.
Thanks, Robin. Senator Lesser, you want to say a few words?
Yes, thank you, Madam Chair. I'm Senator Matt Lesser. I'm the Senate co-chair of the Interest Real Estate Committee and as well as the vice chair of the Human Services Committee. I'm interested to hear what people have to say today. You know, we are, as Representative Wood noted, in the middle of an open enrollment period. So I think the first focus is understanding where we are in terms of signing people up for the vastly lower healthcare that is now available. I've heard firsthand from constituents who are saving $1,200 a month thanks to the additional supports that are now available, both the Rescue Act funding and also the Covered Connecticut program. I think separately, I'm going to have a lot of questions about Covered Connecticut. Unfortunately, I know that the DSS and OPM are not here, and I think they would probably be the most able to answer some of the questions that I'm likely to have about where Covered Connecticut is and how we can best expand that program to help ensure that the exchange remains affordable and that copays and deductibles and cost sharing do not remain a barrier. But the most important message that I think the public can take away is that if you had sticker shock before, if you went and shopped on the exchange and found that it was not affordable for you in the past, it probably makes sense to take another look because since May 1st of this year, prices have dropped dramatically thanks to support from both the federal government and the Recovery Act, and then through the budget, through the Covered Connecticut program. I'll be quiet now and turn it back to you, and look forward to hearing from the panelists you have this time.
Thanks. Senator Anwar, do you have some opening remarks? I think you might.
I hope you can hear me.
Your connection is very unstable. Okay, why don't we come back to Senator Anwar and we'll pass over to Senator Wong here. Representative Pavlock D'Amato.
Good afternoon, everybody. I just wanted to thank everybody for coming and for spending this time to update us. I know it is an important issue for everybody, and I am looking forward to hearing the updates and, of course, any help that we can give. I am also looking forward to seeing what we can do for the exchange to help them out. Thank you.
Great, I'll turn it over to the chairwoman of the Human Services Committee, Kathy Abercrombie.
Good afternoon, everyone, and welcome to everyone being here today. Thank you so much for taking time out of your busy schedule. Thank you, Madam Chair, for including Human Services in here. I think that going forward with the covered CT, I think it's really important, the connection between Human Services and Medicaid and the private market. DSS is not here today because of the fact that until we get approval from CMS, they really can't answer a lot of questions. That's the reason why we thought that we would have Vicki Veltri here, because she will be the one in charge of making sure that individuals are being covered up to the 163%, which is what we were looking for, which is what we were at under Husky. So Vicki, I think, can answer some of the questions that Senator Lesser may have, and that's why DSS is not here today. I'd like to thank the members of the Human Services Committee that are here today. I don't see any of our rankings or my co-chair, unfortunately. I know my vice chair sent her regards. She has some personal matters going on that she has to attend to, but I thank all of the Human Services members that are here today, and I thank you, Madam Chair, for your leadership on this issue. I think it's important to get the message out to the individuals in Connecticut. What a great, great opportunity this is for individuals that don't have insurance. So thank you, Madam Chair.
Great, so let's get started. We'll start with Vicki Veltri, who's with Office of Health Strategies and who's administering the Covered Connecticut program. And I'll just ask all the members that are on to just raise their hands, and we'll call on you if you have any questions after each speaker. Thanks, Vicki.
Thank you. And it's great to be here today with all of you. I'll be so happy to see you all in person sometime back at the LOB. It's always a good experience for me to interact with our legislative partners. And the Cover Connecticut program is really an example of a partnership. We talked about this for a while with our legislative partners, and that's how this program came to be. So I'm going to share my screen for a few slides and then obviously open it up to any questions anyone has, hoping my screen share works. So can everybody see this slide?
Yes.
Everyone see it? Okay, I'm not sure actually how to make this a complete full picture, but I'm hoping you can see it. Somebody can tell me if they have a tip on how to make it full screen, but in any case, begin with the substance. So I am going to talk about Covered CT today. So the Covered Connecticut program was passed as part of the budget implementer bill. And sections 15 to 18 of the implementer bill are really the key sections that describe the program. The program charges the Office of Health Strategy in consultation with DSS, CID, our name for the Connecticut Insurance Department, and Access Health Connecticut with working together on this program. The program builds off of the American Rescue Plan. I know that James is going to talk about that a little bit more later, so I'm going to defer to him to give you all the tidbits about how helpful ARPA has been to people on the exchange in terms of saving significant amount of money getting covered. But under the Cover Connecticut program, what we wanted to do was build off of that. So effective July 1st, which just passed, our Cover Connecticut program provides free coverage, free comprehensive health coverage at this point for the first year to caretaker relatives and parents. And those of you on human services will understand caretaker relatives, which is the phrase used for households with tax dependents, so people who are in that same household for tax purposes, with incomes above 160% of federal poverty, up to and including 175% of federal poverty. And the reason for that framing is, as Representative Abercrombie said, the Medicaid program covers right up to that amount, the low end of the amount. And we wanted to make sure we covered this gap for people who are in this income bracket, which is a pretty low income bracket, and people need access to comprehensive health insurance in a way that ensures that they get the coverage they need. And that means wiping out their premiums, wiping out all their cost sharing, including copays and deductibles, et cetera. So for the first year, we're covering these caretaker relatives and the dependents in their household who are between those income brackets. Next year, this program is going to broaden even more to a significantly higher number of people. And after July 1st of 2022, and the reason it's a year from now is we need that waiver that Representative Abercrombie mentioned, we will be expanding the program to include all adults above 138 or so % of the federal poverty level, all the way up to and including 175% of the poverty level. That's a significant number of people by our modeling. That looks like it could be potentially up to 30,000 or so people, additional people to be covered. We're also, in addition to wiping out any additional premiums people may have, any of the cost sharing, deductibles, copays, coinsurance, et cetera, we will also be adding in Medicaid, from the Medicaid program, dental coverage that the Medicaid program offers, and non-emergency medical transportation coverage. As you know, two critical services that Medicaid currently provides that we wanted to add to make sure this package was comprehensive. We all know the link between dental and healthcare. And we also know that people have challenges getting to their providers without the availability of non-emergency medical transportation. So that's a rough outline of the program. The eligibility, to go into a little more detail here, let me bring the screen down. So again, for this first year, you have to have one dependent child in the household below the age of 19. And a child who is 18 years old in the household must be a full-time student. Those are federal requirements that mirror the Medicaid program. So we wanted to mirror, right, Medicaid eligibility at the beginning of this for the caretaker relatives. Again, I said the income brackets. You must also obviously be eligible for what we call advanced premium tax credits. Advanced premium tax credits, people, the way we've designed the bill, people who are eligible for APTCs, as we affectionately call them, because everything in healthcare has an acronym, are offsets to people buying coverage. So let's say you get a premium tax credit of $500 and your premium was supposed to be $900. In a bill, you would see a bill for $400. Those premium tax credits offset the premium. And you also need to be eligible for cost sharing reductions. Cost sharing reductions are the help people get through the federal government already under our exchange to offset some of their co-pays and co-insurance. People who are in lower income brackets do get help with cost sharing reductions. But to do that, they must be in a silver plan on the exchange. I'm sure James will address this later, but the silver plan is where those cost sharing reductions are. So for us to build off of what's already in federal law and supplement that federal payment, we need people to be in those silver level plans. And the other piece of this is we need people to also use 100% of those advanced premium tax credits. There's a small subset of people that the Access Health team is reaching out to right now who, for one reason or another, did not choose to use all of their tax credits at the beginning of the year, because you don't have to, but they may have projected they might have a tax liability and they wanted to hold off using all their tax credits. But for us to effectively build off of the program, we need people to use 100% of those tax credits and to also lessen the state's exposure to paying additional costs. So those are the eligibility requirements. A little bit more here, and I'm sure this will help you. And I've sent MAPOC and BPOC, our Medical Assistance Program Oversight Council and the Behavioral Health Partnership Oversight Council, a little bit of information that they ran down the list. I think Dave Kaplan sent that out, which I really appreciate. But the information, we know that people don't walk around, oh, geez, I'm at 160% of the federal poverty level. People don't know where they fall in terms of the income levels as a measure against the federal poverty level. So we took the income guidelines and turned them into a chart for people. And we've been putting this out on social media. So people understand if you're a household of one, you need to be at $20,416 or less than and up to $22,000 to qualify for Covered Connecticut. And so it goes across that chart. Let's see what our next, I'm sorry, I'm having a little trouble here. So I just gave you, here is a chart of information. Access Health, DSS, CID, and OHS work together on developing communication document that we could share out with the world. And that document, I think I have a link at the bottom of this slide, so anybody who has these slides can click on it and get to it. But there is a series of frequently asked questions, which I'll touch on in a minute, and the information on eligibility. The important thing here is, and a lot of this information might not otherwise be intuitive to people, but there's certain people who enrolled in, as I said earlier, a bronze plan or a gold plan. We need you to be in silver. So and what we mean by these levels is a bronze plan, for the short way to describe it, bronze plan generally has lower premiums but higher cost sharing. A gold plan has higher premiums and lower cost sharing. And the silver is kind of right in the middle. But the silver is the one we're building off of. So we need people to make plan changes if they're not in the silver level plan. So Access Health is working with those right now. And I mentioned also that people need to take advantage of all the financial help that the federal government is providing, and then we're building on top of that. The other thing that's great that the insurance companies, Anthem and Connecticut, agreed to do is to issue new insurance cards to people who are in this program that will show no premium, no cost sharing. That's really important because sometimes at the provider's office, we don't want anybody going to a provider's office and a provider seeing a copay or a premium on an insurance card. We definitely do not want our patients stuck in the middle on that issue. So we were very happy that the carriers helped us out and agreed to do new insurance cards. I just want to make sure people know, because we were working on this so fast, trying to get this up and running. There may have been a possibility that a few people might have gotten a bill on July 1st when this plan started, or a couple of days afterwards. And we have been urging people to please contact the insurance company. The insurance company will refund the money. They will refund any copays and premiums that people may have gotten incidentally. The other thing is, it's really important to put out there, Access Health's phone number. I'm sure James will talk about that, but on this page, the phone number is right there. We're urging people to call to get enrolled. Access Health has done a lot of outreach, but we still need the uninsured population to get into the program. So we need people to call and get enrolled. So I just put a couple key Q&As on a couple of slides here, because sometimes people ask me, is this really free? I'm like, yes, it is. These are key FAQs, because I've been asked from everybody from the most sophisticated healthcare providers and in the state, all the way down to our individual consumers and advocates. It is free. What is happening in the design of this program, as I said, people have the zero cost cards, or the cards with the zero premium and zero cost sharing. The carriers are going to do what they do with the federal government. They subsidize the cost sharing, premium assistance, then they get refunded by us. So OHS has contracts that we were able to negotiate in 1 week. Thank you very much, Anthem and Connecticut, to refund those carriers any expenses they're laying out. So it's a really easy process for the consumers, invisible to the consumer, and works and builds on the existing federal way things are done. So it was much less complicated to do it that way. The other important thing here, Access Health is the only place people can get this financial assistance. So it is critical that people come through Access Health. If they're doing off-exchange plans, they're not getting tax credits anyway, but they're certainly not going to get Covered Connecticut, because Covered Connecticut builds off of the plans on the exchange. So absolutely critical, if people want Covered Connecticut, to please, please, please visit Access Health. So these are a couple of these questions I've already covered. You got to use all of those advanced premium tax credits. If you're paying a low premium, you might be surprised. People may be paying a very low premium now because of ARPA. I think Senator Lesser mentioned that. You may be down to $5 or 50%, or $50, let's say. If you're down to $5, you can be at zero and have no cost sharing or deductibles. So we need you to come in. If you're an existing customer, please come in. If you're not an existing customer, make the phone call. Either way, we want you in. If you're in, the other question we've been asked often too is, if the income isn't the same every month, do you still qualify? The answer is yes, because we base our adjudications on income, on annual income, not monthly income. But people should be reporting if they have an income change to Access Health. Those were key questions I wanted to cover. There are links there. And this is just an example of one of the tweets we've put out. We are out there with tweets. We're out there on using our extensive mailing lists. We're using media contacts. We're partnering with community organizations. I'll let James talk about that a little bit when he's up next. But the goal here is, we're not going to necessarily reach every customer through social media, but through our contacts on social media and other vehicles, we're reaching those community organizations that touch the patients here that are in these income brackets. So it's critical that this information keep getting out. So that's a bit of a summary, and I'm happy to take any questions. And I guess Representative Wood, I just asked, should I take my screen off? Should I stop sharing?
Take the screen off, and
Okay.
we will go to, I have some questions, but I have a feeling that they will be out. I'll just hold mine to the end. We'll go to Senator Lesser.
Thank you, Madam Chair, and thank you, Vicki, for your your testimony, and I understand that we passed the budget implementer not that long ago. So it's really incredible that this program is already up and running and helping people so quickly. And I think it's a testament to Access Health, to your office, to all of the folks at OPM, et cetera, who have worked together to get this off the ground. And it's really incredible. The problem is that nobody knows about it. I've certainly seen no public facing efforts to communicate what's going on. And I think you talked about those challenges. For those of us who are on the Human Services Committee, we're familiar with Medicaid, which has a rolling enrollment period. Anybody who's eligible can sign up for Medicaid at any time. But here we've got a program that people don't know about, where you can get free Medicaid-like coverage, private plan on Access Health. But you've only got a couple of weeks. You had until August 15th, and nobody knows about it. One, is there a way under the existing law for either the administration or Access Health to waive the open enrollment period or to extend it? Are those options that are available to us?
So let me start by saying, first of all, thank you for the compliment. And I also want to extend a huge thank you to DSS and CID and our carrier partners, because frankly, it's been a joint effort across the board. On the knowing about it, it is tough to get this message out. And we honestly think the best place to get the messaging is through community, on the ground community outreach. And that could mean visits from people on the ground who we work with all the time, our certified application counselors who enroll people all year for Medicaid and during the open enrollment period for Cover Connecticut in the exchange, or at least Cover Connecticut now. And to just get this word out. In fact, we're hoping our partners on this call today will help us get the word out as well. We know some of you, thank you for already plugging it and getting it out. We need the word to get out as much as possible. In terms of open enrollment, I will be open here. I have not had a detailed conversation with either Access Health or anyone about extending the open enrollment period. There are federal ties to extending an open enrollment period. So I think there would have to be discussions with the feds potentially, but I'll let James take that because I think he probably knows best on that.
Sure.
Are you on, James?
Yes, thank you,
Take it.
Vicki. And Senator Lesso, thank you for your question. With respect to outreach, we know mass media outreach, given our experience, does not work with the population we are targeting. So we have done, there are 3 groups of Connecticut residents that we are going after. Number one, we have the ones that are in our system. We need to qualify for they qualify right now. So we've done targeted outreach. We've called them, we texted them, we sent them emails. Then there are folks who came into our system, went through the process, but did not buy a plan. The $10 a month may have been too expensive for them. But we have their information, so we are reaching out to them directly. Then you have the at-large population, the uninsured. They could be, we have a good idea where they are, and they're in the pockets of the cities in Hartford and New Haven, Bridgeport, and New London, and so forth. Then, as Vicky indicated, we have partners across the state in the community, community relationships that we have developed over the last 9 years. That is the most effective way to get to them, but as well as local media in those markets. But to do a mass media TV where you would see it, that would flood our call center and lock them up where they wouldn't be able to help anybody. And also the people that we're trying to reach, mass media, most of them would miss that as well for a number of other economic challenges within their own lives. So again, the hardest to reach population, we have to go into the communities, work with our partners to get them access, to make sure they're aware of what's available to them. And that we are doing, as you indicated earlier, this started about less than a month ago. And we've made a lot of progress. Then we show it to 700-800 folks that have enrolled. And again, those are the folks we know. we've targeted, they've come in, they've enrolled, and they're saving money as we speak. But the balance of that is going to be when I'm going to hand-to-hand combat. You have to go into the communities, knock on doors, and talk to them, which is what we're trying to do now.
Okay, I guess I've got two sort of follow-ups specific to that question. One, if you do outreach to the general public where you're letting them know about the Covered Connecticut program, someone goes in, they determine their eligibility, and it turns out, their income is just a little bit too high for Covered Connecticut. They're more likely than not, according to your own data, Mr. Michel, likely to benefit from reduced cost sharing, increased premium support through ARPA funding. So, not getting Covered Connecticut isn't necessarily bad news. They may still be huge beneficiaries. So I don't know why we wouldn't want to do a giant public-facing promotion effort to get the word out. And two, even if you do that community-based targeting, there's going to be a lot of time that's involved in building that up. And so if we run out of time on August 15th, I have a lot of questions about how many people you could possibly sign up over the summer, even with the best boots on the ground effort. And that's why I was really interested in hearing if right now you'd be willing to commit to these two committees, if the exchange would be willing to extend that deadline to give people time to actually take advantage of this incredible new program. I have one question though that sort of follows up for Vicki. It's also related to this because I know DSS also has an outreach role, and they're not here, but because Vicki is representing the administration, I didn't know if she had information about anything that DSS might be doing as well to complement your efforts on the ground.
So very quickly,
I'm
Vicki,
muted. Go ahead. Okay, go ahead, James.
Very quickly, with respect to the deadline, Senator, let me just, my chairman is here, Charlie Clipper is on. Our core mission is to lower the uninsured in Connecticut. So we'll do everything continuously to make sure that happens. Unfortunately, with this deadline, as Vicki indicated, it's attached to the federal government, so they're on the hook for the extra money. So whatever we do, we have to coordinate with them. And we have been, I've reached out to them because this question came up earlier in the week, and we've reached out to them to see whether or not they're going to be willing to extend it. We have a meeting this Friday to discuss that in length. So I will get back if they say yes, we'll continue to do it. With respect to the mass outreach in part media, I think in that case we may create more problems for our customers than helpful. Our call center is simply not staffed to receive the volume of calls that would come in through a mass media outreach. They're not, because obviously when we know we're going to have a large campaign, we would work with our call center vendor, their staff up, they're trained. Otherwise, people will call, they'll wait, and then they get discouraged. They stop trying. All right, so that's at this point, again, with about a week or two to plan to lay this out. Our call center vendor just did not have enough time to staff up our call center for a mass media campaign. But again, we are doing everything that has been successful over the last 9 years rather, to get people enrolled through access of, especially the targeted population we are talking about.
So, James, I don't know if anybody is seeing you, but I'm not. So I don't know if your
yeah.
camera's on.
No, I'm not. I'm having a challenge with my camera.
Okay. I just
Okay.
wanted to make sure it wasn't that you did.
No.
Okay, so, and Senator Lesser, regarding the second question, we've been working with DSS very closely on the outreach, and DSS I think, has blasted out information to all of their community partners, the action agencies, all the folks that work with consumers with DSS, as well as putting information in regional offices, because some people are right over that line for Medicaid, or they may be getting other DSS services that they may qualify for different reasons. So we've been working with them closely on outreach too. And we are working hard to try to cross-reference the lists of people who, might have kids on Husky A to the caregiver relatives who are maybe uninsured. So there's a ton of work going on behind the scenes on that.
Yeah, there may be some folks who are on TANF or SNAP
Right.
that may qualify. So we're working with DSS to get identify those families so we could do direct outreach to them as well.
So I just had a question as well about the status of the 1115 application. And I know that the immediate focus is on August 15th and getting people signed up for that. But the 1115 process is ongoing. There was a report out yesterday that the state's fiscal position has improved. And so my understanding is that under federal IRS rules, we could do what Massachusetts is essentially for 300% of income, at least with some level of state support. But I also want to be mindful of what steps that we can take to ensure the long-term viability of the Covered Connecticut program, assuming that it's a successful model. And so, Vicki, I don't know if you have thoughts about what we can do establish a trust fund or something to make sure that this, if this is a model that works, that's something that can continue in the out years and potentially at a larger level, more able to benefit the middle class.
Yep. So I think a couple responses to that one. First, on the 1115, I know from Kate McAvoy, our Medicaid director, our fantastic Medicaid director, that DSS is already working on its part on the 1115 waiver. They do think it will take them the time that it takes to do a federal waiver of this magnitude. We are modeling it off of the Massachusetts program. We've had discussions with Massachusetts. There'll be further discussions with CMS as well in advance of finalizing a waiver to assure that we can maximize our federal benefit from the federal government. So there's already work going on behind the scenes. They are also working with Mercer, I believe, to help them formulate that waiver. And Mercer's been a longtime partner for DSS and expert in waivers. So I feel pretty confident about how that process is moving along. In terms of expanding the program, I think one of our issues is getting it up and running now and making sure it's buttoned up and any potential issues or any bugs or anything is worked out for the key population right now and the 40K total, 40,000 who we think are fully eligible for the program next year. And we think even that has the capability of shoring up the exchange in a significant way by adding up to 40,000 people to the exchange. And then talk about, exploring the potential to shore it up further. But I hear where you're going. But right now we are zeroed in on those two populations that we have right now.
One last question. I want to thank both of the committees for the indulgence. You mentioned something, Vicki, in your remarks about how only people who are on silver plans are eligible. I assume from that there are low-income folks who are on bronze plans who are paying money right now who don't have to be paying money.
That's correct.
Is there a reason we can't just automatically move them over to maybe we get a richer plan for free as opposed to a poorer plan that they have to spend money for? What's the barrier there, and how many?
So I'll let James supplement my answer. Sure. But the issue is, people have the right to select the plan they want. So they're in that plan, and we can't automatically move them unless they're actually in the silver. So we need to do we have to do a manual outreach to each one of those people to explain to them, look, you may be in bronze because you think you're saving money on your premium, but you may be paying a deductible and cost sharing. We want you to have zero, everything. So that means we need you to move over. So we're actively doing outreach to every single one of those people who's chosen a plan that is not the silver plan. But James, do you have anything you want to add to that?
Sure, very quickly. Senator Lesser, if they chose a bronze plan and they qualified for a silver plan, especially at 87, our system default to the silver plan. So they have to actively select a bronze plan. So they may have had some reasons why they did that. And again, we cannot automatically change their selection to what we think it ought to be to benefit them financially because they may have made that decision for their own personal financial reasons. So that's why we are calling them, we are texting them, we are harassing them, tell them to come in. Some of them may still choose to not do that because maybe they're choosing to get the tax benefit at year end, or maybe their income fluctuates throughout the year and they don't know what it's going to be at the year end. So they're taking a very safe approach by choosing a bronze plan so that they don't owe the government a whole lot of money at year end. Now, if we make that change for them they want to own the government at your end, we will be on the hook for any tax liability on their part because we chose the plan and change their decision.
So how many people are we talking about?
Hey, Rob, do you have a number for that, Rob? I don't think it's a big number.
Yeah, 140.
How much? 140, you said?
140.
140, Senator.
Okay, that seems like a reasonable number of calls to make. But
Yes.
No, we've called, we've texted, we're harassing them. We're going to keep harassing them until the 15th
We're not,
of
we're not
August.
harassing them to the legal standard of harassment.
Well,
but
no,
we are
no.
trying to persuade them.
Well, and I'm being a bit facetious about this.
I
But
know
the point is, we want them to benefit from this program. So we're going to be as aggressive as we possibly can be. We fought going over the line to make sure every Connecticut resident get access to this valuable program.
so I misrepresented myself earlier. I said that I had no more questions, but I just realized I've been told that California has extended open enrollment to December 31st. Is there anything that would prevent Access Health from just doing that if California has gotten permission to do that?
Yeah, they may have done that, but they may be doing it without the ARPA, without the American Rescue Plan in place, right? And if they're doing it with the federal government's blessing, we will do it as well. Again, I'm meeting with CMS Friday to explore that with them, and they say yes, we will come back to my board, and then we will move forward.
Terrific.
Thank you. That would be good news for all of us to hear. I'm going to move on. Thank you, Senator Lesser, to Representative Ann Hughes. And we do have a lot of people with their hands raised, so I just want to make that comment. Thank
And
you.
Representative Wood, I will just say that I got a notice that my 2 is canceled. So if we need to go longer, I'm happy to stay.
Yay. Mad love to all of you for like fast tracking this huge bureaucratic effort. And I know that is not easy systemically to offer this to our Connecticut population of 3.5 million people. It's incredible. It's an incredible success already to get this up and running. How many silver plans do we have currently on the exchange?
Hey, Rob.
Let me just make sure I understand. Are you asking how many individuals have enrolled in this silver plan for the Covered Connecticut program? Or are you asking how many silver plans?
Overall.
How many silver plans are available on Access Health Connecticut?
If a consumer were to come onto our website and shop for plans, they would see 2 silver plans available, one from Connecticut and one from Anthem.
Okay, great. And also, I mean, I have sent out in my e-news multiple times, and I just asked my press person to get another one to just try to get people to get onto that page that you know, with those frequently asked questions. Again, it's all about outreach. I'm noticing that there's a lot of newly unemployed or underemployed people that don't really see themselves as part of, they certainly don't see themselves as ever qualifying for Husky.
Mhm.
And so I'm really trying to get eyes on that they might be exactly who can qualify. They see themselves as part of the middle class, so they're not seeing themselves as eligible
Yes,
for
it's
subsidies.
unfortunate. Yeah,
James,
James, do you want to talk about the special unemployment?
Part of my presentation, we talk about the how we are helping the unemployed Connecticut residents.
Yeah.
We have a very strong, robust relationship with the Department of Labor, where any layoffs that's happening, we know about them in advance. We do outreach to those future unemployed Connecticut residents to make them aware of what's available to them above and beyond COBRA.
Great, because
People in
there's
that
an
category.
intersection.
Oh, I'm sorry. I didn't mean to interrupt you. I
No, go
apologize.
ahead.
People who are unemployed and got the help from the federal government to be in considered a certain income category for purposes of insurance coverage, we're helping them too as part of Covered Connecticut. So
That's part of our presentation where we'll talk about how many and more importantly, how we're helping them to maintain their health insurance.
Great, and I just realized as I'm doing in my other full-time job, a lot of scam prevention, fraud prevention. We're telling people not to pick up the phone if they don't if they don't recognize it as a known contact. So really, we're trying to protect people, especially older people. And yet we're trying to get people to respond to these outreaches. So we may be cross purposes in terms of outreach, and that's why those community partners are so important. But again, I'm noticing a large section of the population that may not be tuned into those community organizations normally. And how, I echo Senator Lester's concerns about how we're getting out to the public in ways that they do trust, and will explore that they may be eligible for these like zero cost premiums and subsidies, but they have to, they basically have to be proactive about it. It's not just going to automatically enroll.
And I mean, to add to I totally hear your concern. And so beyond the community organizations that Access Health has a huge list of, we do too, lots of people have lists of community organizations, particularly people serving populations, not everybody speaks English. We have 60 languages in some counties and even more in some other counties. We have to reach those organizations. We also have to reach our provider partners. Frankly, our hospital partners, our provider partners on the ground can help people as well. Many of the hospitals will enroll people right at the door when someone's uninsured. So they are key partners in this because most providers have a trusted relationship with their patients, or patients trust their providers. Lots, I know I do. So that's also a key constituency we have to get to, as well as other organizations that aren't necessarily people's, direct people service, but are related enough to insurance. Did you know, I'm serving you on this, but if you need help with insurance, we need to help you get enrolled there. So there's a lot of work going on right in those areas. I completely agree with you, Representative.
Okay, thanks. That's about it for me. And I just love that they're issuing new cards that say, no premiums, like as much as we can to make it user friendly and seamless for the person. I
have to say, we asked the carriers to do that, and right away, they were so we were very grateful that they did that.
Thank you, Representative Meskers.
Thank you very much. Couple of quick points and questions. I'm hoping there is a good coordination between Connecticut and the overall exchange process for all of the programs, so that the marketing is comprehensive for everyone who qualifies up to 400% of the federal poverty level. So I'm hoping that the outreach is a little more aggressive than what I've seen to date. I'm looking at the federal subsidies coming into this program as a tremendous opportunity for all of us and for our disadvantaged population to improve their consumption and spending power by subsidizing their medical cost. So it's a win-win for the state. So I encourage you, one, in terms of your application process, we have only 3.5 million people in the state, but we do have 2 senators who are pretty aggressive senators. And I think if you're looking for a waiver and an attempt to extend the enrollment process, I think Chris Murphy and Dick Blumenthal would be people I would rely on and lean into. So I encourage you in that format to take care of that. And with respect to the marketing effort, I was, 35 years of sales. I would tell you, there's no way an insurance product that you sell annually is going to have good penetration in terms of the relationship with the individuals. And that's not you, it's whether it's the guy he's selling to the multimillionaire or the guy in the housing complex. So I'm hoping, those social groups, and what particularly comes to my mind is in the Department of Social Services, obviously everyone who's receiving some form of housing subsidy in Section 8 housing, and in terms of all of our volunteer food pantries. I'm not sure if the information has been published and available to the food banks and to all of the participants in our food pantries, because that's going to be an eligible population both for the zero cost in some cases, but certainly those who are down on their luck, who may be at 200, 300, or 100 times federal 150 or 200 times federal poverty levels. So I'm hoping the food pantries become part of that marketing effort, because if I think of anyone who's dealing with our disadvantage on a daily and weekly basis, it's the food pantry, right? So I encourage you to think from the point of view of which social services are touchstones for outreach. And lastly, from both our side, on the legislative side, I'd like to know with emergency room visits and usage, if we have any gathering of information from the hospitals to make sure that we follow up with strong outreach for those people who are using the emergency rooms because they are uninsured or underinsured. So, I mean, that's a captive audience where we should have a strong opportunity for marketing. And those would be, I don't know if those are questions or observations of how we should move forward.
Those are good points. I think they're all really good points. Access Health, James can answer on the
Sure.
sheer comprehensiveness of their community partner list. And I can talk a little bit about the hospital. So James.
Sure. Representative, thank you very much for those comments. With respect to the carriers, we have extraordinarily strong relationship and communication with both carriers. The plan that Vicky talked about earlier in implementing the Connecticut plan, we had like a 60-page project plan that involved Access Health, OHS, DSS, both carriers, and CID. And that was going on every day for about 8-10 hours a day so that we could get this plan up and running. So, and the carriers are also doing their own outreach to any customers that they have that meet those requirements. With respect to the community outreach, the food banks, we partner regularly with the food banks on a regular basis. Matter of fact, when they are distributing, we are there. We give them our bright orange bags to distribute food in. So we already have that relationship, and we are pushing information out to them as well.
Sorry, I don't want to speak over, but I've been in touch with two of them who, for both their employees, and I would suggest they are still not up to speed. So I'm not sure how you personalize some of that. I'm just telling you, the food banks are a weekly touch point with our most vulnerable residents. So I just encourage that we think about a marketing Zoom call to the people who run those food banks and make it really lean in on them. They are touching that population like nobody, in my humble opinion.
We agree with you. That's why we partnered with them over the last several years, because they have a very dependency of Connecticut residents who depends on them for basic needs. So we are there on a regular basis, especially during open enrollment. And if there's a crisis in the community, we are there working with them to make sure their customers, if you will, have access and know about Access Health, know about Medicaid, and also we enroll them on the spot if we are there.
So, and to supplement on it's a very good point about the hospitals. It's a win-win. I think it's clearly a win-win, right? The fewer uninsured people we have, the better off we all are, because we can ensure people have access to preventive services, all kinds of services they need. So we're not, utilizing ED services unnecessarily. So I see the hospitals and actually the practices across the state of Connecticut, all the practices across the state of Connecticut, as partners in this, in the enrollment, because they already do the enrollment, right? The hospitals clearly do the enrollment. But it's definitely a win-win. If we need to get even more information to them, I'm totally committed to that. We've got to make that happen, because that's a natural partnership on this initiative.
Okay. And lastly, just on the extension, this is a repeat. I think it's imperative that we lean in on our federal senators. I think you can count on them to advocate for getting a federal waiver so that we can continue to market the program. But thanks.
Thank you, Representative Jason.
Thank you very much, Madam Chair, and thank you, Vicki Veltri, as always. You're so knowledgeable and do some wonderful things at communicating all these opportunities to people in our state. You touched upon a lot of the things that I was questioning, but it seems to me that Most people don't really think about this until they're at the doctor's office. So you did touch about it. But in terms of like our FQHCs and other community health organizations, do we have the ability for people to, for them to actually help so that they can get more of their costs reimbursed, help and get the message out to their patients? I mean, it behooves them for them to do that. Is that part of any of the outreach of the, especially for these 140 people that are in some of these plans?
So James, am I correct that and Rob, whoever can answer the question, that the community health centers are also CACs? Are they application counselors? I think they do enrollment already.
Many of them are. Many of them are. They enroll every day. They enroll in Medicaid as well as QHP.
Right. So if we're missing some, we'll have to be sure we get to the rest of them. But yes, agreed. That's also a natural partnership there.
Yeah,
Vicky, most of them, if not all of them, are partners of ours.
Yeah, that's what I thought. So we can verify that.
Yeah, that's really helpful to know. I know, I guess my question is to you, what can we do to support you guys to help get the message out? I know, like Rep Hughes, I put it in a lot of my newsletters. I post about it on Facebook, but would love to be able to make sure we get the word out. So if you do have ideas, I know that this group would love to be able to support you in that. And then my final question is really for someone who it has kind of varying amounts of income, where they're not sure where they're going to end up for the year. Maybe they've been on unemployment for part of the year. Maybe they've worked in a restaurant for part of the year, and it's kind of all over the place. And what happens? What are the implications, and what can someone do if all of a sudden they realize, you know, at the end of the calendar year that they may have just slightly gone over, but you know, the following calendar year they see themselves in line with the income limits. What can someone in that position do? So
fortunately for this year, if they were unemployed or unemployment for 1 week during the year, they would have the best plans, affordable. They would get we assume that they're at 133%, so they would get a very rich plan or at almost no cost to them. For this year, with no exposure in terms of income variations. But for other cases, if your income varied throughout the year, again, all of the documentations, all the communications we do, we ask them to come in and update their information on a regular basis.
Yeah, and the reason we do that is because we don't want that exact situation that you just mentioned
to happen.
Right. And you know, there's still an open enrollment every year. So even if somebody's enrolled this year, they're going to have to come in during the open enrollment period and re-enroll for next year. So there's always the opportunity to switch a plan if the income goes, you know, up above that amount.
By the way, you could come anytime during the year and report a change to update your income anytime.
Yeah. And if there's confusion, I think the call center, people talk through these issues with people to try to resolve them.
Absolutely.
There may be an income variation or something.
Okay.
All right,
Good to know. Thank you so much.
Thank you, Representative Dathan. I'm just going to jump in with a few comments, and I want to just make sure everyone's okay with this. I wanted to switch it up to Joe McDonough. I know I see some hands still up, but I know some people that are speaking do need to jump off. So if everyone doesn't mind, I do want to get the perspective of the brokers selling on the exchange, and then we can wrap it up with having the Access Health team do their presentation. I think a lot of the questions that people have may get answered during that process. And then if there's still questions at that point, we can move on. I just know it's summer and I really appreciate everyone's time, but not everyone can stay on all afternoon. Is everyone okay with that?
Yes.
Okay. Let's do Joe McDonough, would love to hear your perspective from the brokers on how you guys are working on the exchange and if there's room for improvement and how we can help.
Thank you. I appreciate that. Thank you very much. I'm going to compliment the exchange. And I don't know that we give as much credit, but the customer service department is extraordinarily adept. And most of the calls that I get these days are, I'd say I get about 3 to 5 phone calls a week. And they're from people who have been referred to me because they get to a certain point and the customer service department is not permitted to tell the customer, the client, which plan or to even comment on the difference between the plans and what is appropriate or not. Most of those calls, many of them I should say, take about 15 minutes for me. And that includes small talk and asking how everybody is. Because these are people today, a woman's son was aging off her plan. He turned 26. He makes $18,000 a year. The silver level plan that he would get would cost him $1.02 a month. It has a zero deductible, $10 copayment for doctor visits, and I think it was like an $800 or $900 maximum out of pocket. So most of the calls that I take, I tell people to keep my phone number, but these are people who are not going to become clients because honestly, it would take me another half hour, 45 minutes probably, and I'm adding nothing else to their experience. I'm just verifying what, it wasn't that hard for this woman to understand that $1.02 is pretty good. But when I run into problems, and that's the one phone call every week or two, and usually it's because, and that's part of the, I don't know that it's Access Health's problem. I think it's in part of the structure. The website is so complicated, and some of it is complicated out of necessity because you are asking to have the federal government pay some of your premium, but some of the questions are poorly worded. So those are the phone calls that I end up spending a great deal of time on. In some cases, it requires the assistance of the customer service department. But I can honestly say I have not had a bad experience in the past year with Access Health's customer service. I did want to mention something else, and I was interested actually to hear what John Carbone had to say about it. I have a feeling that the American Rescue Plan Act is going to some degree, it may make the shop window at Access Health irrelevant and obsolete. My clients who are in shop do it because they can, partly because they don't need to have the same verification that they might have if they went direct to Connecticut or Anthem. And instead of, as Connecticut or Anthem might require, paying 50% of an employee's cost, they can pay less. But that means that the employee, particularly after with the American Rescue Plan Act changes, that employee may end up paying more for his or her plan on shop than they would pay if they were to buy a direct plan as individuals. Now, they don't get assistance from their employer, but they'd probably be getting assistance from the federal government that would supersede that. And I'm curious about it because I've always thought SHOP was really viable and underappreciated part of Access Health, but I'm not so sure if it has as much significance as it used to.
John, do you want to answer that question?
Madam Chair, if you will, with our presentation covers SHOP as well, and John is going to do that. So I'm pretty sure John will be able to answer that question.
Thank you.
Thank you, Mr. McDonough. Thank you for your kind words about our customer service. We do know that our website, the application process online is very complicated, very complex because of all the necessary information that we have to gather. And in some cases, we have to do it exactly as prescribed by CMS. All right. So, but however, we have done a great deal of improvement over the last 3 years to make it easier for our customers. And that's an ongoing effort for us. And so more to come on that to make it easier to make some changes. And maybe Rob could talk a little bit about some of the work, some of the steps we're taking to make it easier going forward for our customers to the extent that we can.
If I could just mention one thing, there was a change that was necessary because of the American Rescue Plan Act that asked, do you now want to have assistance in paying your premium?
Right.
And at first, it was in a litany of like 15 questions, including ones like, have you been adopted in the past 60 days? Have you been married in the past 60 days? And then, and do you want help and assistance? And so a lot of my clients missed that.
And we have changed that. And
but those are the kind of things that can cause problems.
yes. And people who missed it, we reached out to them and asked them to come back in and change it so that they could get access to the American Rescue Plan.
Right. Yep.
Okay, so do you have any more comments or should I move on to questions?
No, that's it. Well, one other thing, I think that there is to find assistance to be a broker. There's a link that's on the first screen on the right-hand side that says "Find Assistance," but it's quite unclear. My suggestion might be, and this is self-serving, but there might be again a separate question that asks, "Do you want to have assistance?" People are not aware, for instance, that having a broker or not having a broker doesn't change their costs. It's going to be the same premium. And something like that might encourage people because it's a fair. Once they do it, it's a fairly simple process. Find assistance.
Most of all the mass media marketing we do, we always point out the fact that all help from Microsoft is free. We point that out all of the time, but maybe we need to add that to our website as well.
Thank you.
Thank you.
Great. Representative Meskers had his hand up first, if that's okay, and then Senator Lesser.
Yeah. So, Joe, having worked on Wall Street, I guess my question is there the proper incentive structure? So, as I'm hearing you, the individual doesn't pay anything in his fee structure. I'm assuming you're getting some type of commission for the referral to the exchange? And if you are, I'm just wondering, is it the appropriate level if we're trying to get the market penetration to a certain level in marketing? I saw, where I was kind of shocked the governor was offering $1,000 premium for people to go back to work. So if this is to get a federal subsidy into our healthcare exchange, are we offering the proper level to incentive to get enough people subscribed for the system?
Well, first of all, in terms of brokers, when I just give this woman today whose son lost coverage, I'm not getting compensated. I mean, she could perhaps ask and find assistance or tell them to include me, but I don't think that the effort that I made, which was all of 15 minutes and confirming what you said, deserved for me to be paid. In anybody's occupation, there's stuff that you do that you get overpaid for, and there's stuff that you do that you get underpaid for.
But if we're trying to penetrate this group, is there something it would be helpful from your side to figure out, as well as the nonprofits who were like food banks, et cetera, social services are trying to market, is there something we should be doing to the community that would get some outreach into that community in a commission structure? That's the question.
No, because what is being provided right now, which is, I think it's $15 per month per person, is competitive with what's available off the exchange too in the individual market. It's not competitive with small group benefits. And that's why I think brokers, I'm getting more phone calls, and I think part of it is that there are fewer brokers who are participating with the exchange. I don't know what the numbers are, but I have a feeling it's dropped off over the past 10 years. But, no, I can't imagine anything short of doubling my income that would promote more brokers participating.
Representative Metzger, very quickly, one of the challenges is that there aren't enough brokers of color in the state of Connecticut, particularly in the communities that we are trying to penetrate into. So we at Access Health, we are working on a strategy to increase the number of brokers, both Latino and Black, in those communities. And we're gonna work with our board, our strategy committee over the next 3 to 4 months to lay that strategy out, where we're going to recruit, train, and get a license more brokers of color. Connecticut has one of the worst records with respect to that. We did a study about 9 months ago on health disparities that told us exactly what the drivers of health disparities are. One of them is a lack of access, lack of trust. So we need people that live in the communities to be certified, be licensed, to be able to sell to people that look like them, that's culturally sensitive to their needs. So again, that's a challenge that Access Health will be addressing over the next several months.
That's helpful, thanks.
Yeah, if the insurance and real estate committee can be helpful, please let us know. Senator Lester.
Yes, thank you, Joe, for your testimony. It's good to see you. I just had a question sort of following up on something you said about SHOP perhaps being obsolete, assuming the 400% cap continues to be lifted, the ARPA changes made. I was just wondering if that also holds true for the broader small group market. You see a movement from the small group market onto the exchange writ large. And if so, are there things that we can do to manage the inevitable disruption, get the word out, et cetera? I've heard anecdotally of folks moving over, but I just wanted to see if you had a broader view of that.
Yeah, I think it's not quite as likely, because I do think that, at least in my business, the companies that use the SHOP are those that are paying a smaller percentage of the cost. So it makes it more obvious that it's going to benefit the employee. But yeah, inevitably that may happen too. The one concern, of course, is that the provisions of ARPA are set to expire, I think, December of 2022. So relying on Congress to extend it, I mean, it's very difficult. Congress doesn't like to take something away that is popular, that people have. But if they have to actually act to extend it, we may face a real problem in 2023.
Obviously, anything is dependent on whether or not we'll see what there's news out today. Supposedly, there's a bipartisan infrastructure deal. I don't know what's in it, whether that's real. Assuming that the ARPA support, the additional ARPA support remains, you don't see a major impact on the small group market.
No, but I think that it's not quite as prominent. I mean, a lot of companies, a number of small companies, look upon the health insurance plan that they provide to their employees as a significant benefit, and it's a recruitment issue. To then tell employees, we're going to eliminate that plan and you can go to the exchange and it'll cost you a little bit less, but that means that it's on the employee. The onus is on the employee. It's no longer a benefit. You know, for better or worse, the United States has a health insurance structure that is employer dominated.
Didn't IRS guidance out 2 summers ago give employers the ability to provide premium support for employees who purchase insurance on?
Yeah, health reimbursement accounts. But again, that the onus is on the employee to obtain the health insurance and then submit the claim to be repaid. It's a reimbursement. I don't say that it isn't happening. I'm sure it is happening. I know it is happening. but it's not quite as significant as I think what might affect the shop.
Thank you.
Ms. Padlock-Tomato?
I was wondering, and anybody can answer this. I know we initially talked about Cobra, and I thought that was the free Cobra was going till the end of September, but I had heard that it's going till the end of the year. I was wondering if anybody can clarify that.
My understanding is supposed to end September 30th, the Cobra of this year. I have not heard otherwise, but we will look into it and confirm. And email this whole group whether it ends in September or if it has changed. But less I know is that it was supposed to end in September. We will confirm and get back to you.
Thank you.
Okay, so we will move on to the Access Health CT, and hopefully you will be covering the individual, small business and marketing, plus provide us with some, statistics that I'm sure we'll all ask questions on. And if you want to take it, James Michelle,
Sure.
we look forward to hearing from you.
Madam Chair, thank you very much. And Co-Chair Lester, thank you very much for this opportunity to talk with you. I have a lengthy statement, so I'm going to dispense with it so we get right into the presentation. We will talk about individual health and the American Rescue Plan, how it has helped Connecticut residents save over $5 million a month, and how it has helped the individuals who are above 400% of the FPL, how much money they're saving as a result of ARP, the removal of that cap. Then John will talk about SHOP, about what we're doing to help the SHOP to small business employers in many respects transition their employees to the individual market, because it's better for both the employee as well as the small business owner. And then we'll also talk about our marketing outreach that we have been doing with respect to the American Rescue Plan, as well as working with Vic to support the Cover Connecticut strategies that we've talked about earlier today. So with that said, I'm going to turn it on to Rob. He's going to show you the numbers and talk, and also answer any questions you may have. Rob?
Thank you, James. Thank you, everyone, for joining. I'm going to wait for, we have a slide deck we're going to pop up. I'm not sure if we have someone from the Access Health team on who can pop that up for us. Caroline or Marcin, I'm not sure if you're online.
We got it.
Okay. All right. Whoever is presenting, if you don't mind, if you just put that into presenter view, I think we'll be all set. That's just a tiny bit smaller. There we go. Thank you. All right. So, Caroline, if you don't mind navigating to the next slide. Okay, thank you. So just as a reminder for folks, the American Rescue Plan Act was signed on March 11th by President Biden. Many of the committee members that are on this call may have remembered conversations with Access Health back in March and April as we were getting everyone up to speed in terms of what the impact of this law was. Recognizing that, ARPA may not be a daily conversation for folks. I just wanted to go very quickly over what the impact of the law was before we actually get into the actual impact of it. So let me just recap real quick what's contained within it. First, possibly the two most impactful changes from ARPA were the removal of the 400% federal poverty level limit. So this was also known as a fiscal cliff for families. In addition to that, there was a substantial decrease in the contribution rate expectations from families that were purchasing coverage in the marketplace. So to put that into some sort of format to understand that a little bit better, the table on the right shows that contribution rate, and the two columns on the right show the contribution rate prior to ARP, the contribution rate after ARP. What the contribution rate means is that is the percentage of a household's income that is expected to be spent on a silver level plan in the individual market. So what you'll notice from this plan, from this table, is originally prior to ARPA, anyone with income, a household income of over 400%, no longer received any subsidies. So their contribution rate may have gone from, if they were at 399.99%, it would have went from 9.83% of income. Where if they made $1 over and entered the 400.01%, let's say, at that point, their contribution rate could be 20% of their income. With the introduction of ARPA, that limit was removed. And in addition to that, you'll also notice for FPL levels 150% and below, their contribution rate was 0, meaning essentially they will have free plans available to them at the silver level if they were to come on the individual market. And also every FPL category or band in between 150 and upwards past 400 actually received a reduction in their contribution rate expectations. So in other words, everyone who's on the exchange now gets additional or a greater amount of financial help to purchase their plans. In addition to that, there was a provision within the ARPA that allows individuals who attest to having unemployment income to receive essentially a plan with the equivalent financial help as though their family was under 138% of the federal poverty levels. So again, that brings their contribution rate down to 0%, and that'll make them, that'll allow them to be eligible for a 94% cost sharing plan, which essentially is a plan that will cover 94% of their expected cost share. In addition to that, as we mentioned earlier, a 100% premium payment for COBRA coverage. Last I've heard that is through September, but again, we'll follow up on that to make sure we haven't missed any news that may have come out around that being extended. There was also relief for 2020 tax filers who had received premium tax credits and may have had reconciliation issues. And then lastly, to the points that were made earlier, we recognize that this is anticipated to expire in 2022. It's understanding that from the federal policymakers and administration perspective, it is of fairly high importance or great importance for the administration to see these expanded subsidies continue to move forward outside of 2022. So we're keeping our eye on that. We're hopeful that it will be expanded past 2022. So if we can navigate to the next slide. What we have here is a slide that may look familiar to many of the folks on this committee. This was what we were actually sharing back in March and April. In March and April, what we had done is we had actually done an analysis to project what the impact of ARPA would be on our population. At the time, we had projected that the impact would be about 7.1 million for the entire population, or about 85 million annualized. And then from that, we also had projected a little over 6,000 families would see $200 or more in savings per month, as well as the number of families that would be eligible for $0 cost, $0 essential health benefit plans would essentially double, and that would hover around 34,000 families. So those projections are still are essentially what we're using as our benchmark. Since then, we had a three-pronged strategy we were trying to implement. Back in March and April, what we realized was obviously we need to figure out how are we going to implement this as quickly as possible from a technology perspective, meaning how do we implement the policy changes and have updates made to our system to support residents of the state to be able to take advantage of all these different policies that are available. The second prong was how do we communicate it and make sure the residents know that they should be coming in, updating their application to benefit from it. And then the third was to ensure operational readiness. How do we make sure that our call centers and our customer service channels and our customer individuals that partner with us from a customer service perspective all have the information they need to be able to help consumers to the greatest extent possible. So I'm proud to say that we've made some substantial progress on all three of those fronts. And just to be brief here, because I know we are running out of time, what we've done is we've put together some high-level statistics on the next slide. And this will show you how we're doing so far in terms of implementing ARPA. So over the last 4 months, we've supported over 43% of our customer base in updating their enrollment on their applications to benefit from these ARPA updates. So this accounts so far for $5.5 million of that 7 million we were projecting. In addition to that, that 5.5 million, if you were to compare it to the 7 million, that's about 75% of the projected ARPA savings. And that is partially by design. The reason why is our outreach and our technology changes were really targeting the individuals who would benefit it the greatest amount. And What we did was we rolled out some system changes that actually allowed us to automatically apply those savings to families that had who were essentially eligible for it. There were certain criteria that needed to be met for someone to be eligible for this, but that is what has allowed us to get to that 75% mark. The result of hitting that 75% mark is, to put it into context, we now have a third of our individual market enrollees are now enrolled in a health plan that's cost less than $10 per month for each enrollee in that family. And nearly half of our customer base is now enrolled in a plan that costs less than $50 per enrollee per month. Additionally, we released that functionality that will help individuals who have had unemployment income or have been unemployed within 2021. We released that actually at the end of June. And since then, we've already had 1,200 enrollees who have benefited from this. And again, those individuals will now have a $0 essential health benefit plan available to them, as well as that 94% cost sharing reduction plan, which is essentially almost a $0 deductible plan that will be available to them. A couple things to just keep in mind here as I close this out in terms of my update. As we mentioned earlier, the expanded special enrollment, which essentially allows folks to have a special enrollment event if they're uninsured, underinsured, or would like to take advantage of ARPA, is set to expire on August 15th. We've got our eye on that, and we certainly know that that's an area that we're going to have to support depending on the outcome. In addition to that, one thing that's coming around the corner that I think we all must keep our eye on is the 2022 open enrollment period. So we're planning to start that November 1st. That's the start date we've had for the last number of years. On November 1st, we'll open up our doors and folks will actually be able to shop around for 2022 plans. What that means is by the time we hit the end of this year, everyone who has purchased a 2022 plan will now benefit from those ARPA premiums. So essentially we'll get to 100% of those projected ARPA savings for 2022. In addition to that, the theme for this open enrollment period is going to be different than prior themes for open enrollment periods. And what I mean by that is with the additional subsidies and financial help that folks will be qualified for, it will now be important to make sure that folks are shopping around, not for the lowest priced plan, but for the richest plan that's available for them. They'll have many options available that will likely be able to be very low cost plans in terms of $0 EHP. The question now becomes, how do we make sure that they're actually picking the plan that offers them the greatest amount of protection from cost sharing perspective. So it's going to be a unique open enrollment period. And I think what we're going to find is many individuals will probably be upgrading from bronze plans to gold plans, or from bronze to silver, or bronze to gold, or silver to gold. So we're going to keep our eye on that. We're incorporating that in our communication strategies. And we're also building in some functionality from a technology perspective to help individuals with that process. But on that note, I will pause there. And I will actually kick it over to Caroline and our team to talk about some of the communication efforts that we took during the American Rescue Plan implementation.
Thank you, Rob, and thank you to everyone who is here today. As you know, I am new to the organization. I started just last month, and I'm very excited to have an opportunity to continue engaging with folks. So thank you for making time today, and for bringing up a lot of the questions and comments around our marketing initiatives, certainly taking that into consideration as we move forward here. So without further ado, let's talk about what's been done thus far and what's currently in market to support the American Rescue Plan Act marketing. This is a very big campaign at OE levels to really make sure that we're getting the word out and that people know what's available to them during the special enrollment period, and the different financial help available to them now as well. So what that entails is a really large broadcast advertising campaign. This includes TV, radio, and OTT, over the top, which is just marketing language for those streaming devices. Okay, so how people are getting TV and they're choosing to stream in case they are cord cutters for cable, or making sure that we're reaching out to them that way as well. Print advertising. So I can go through the different markets where we have our print ads, but that does include communities of color and minority community papers. We do have a strong social media advertising and organic post campaign going on, supported online digitally here by digital advertising. and that is paid search. So we're talking about using search engines like Google, making sure the content populates there online when people are searching for key phrases and might not even know that this is available to them. We've also got display and native advertising. Again, some marketing jargon in there. So that is when advertising pops up in the margins when people are on different websites and if it's relevant to them. We've got blog posts. We're doing public relations. So we've got press releases out. The most recent one that we did was when there was 30 days left. So we did remind the media at that point in time. We've already got a media alert that's ready in the hopper for 2 weeks out as well. We have a direct mail campaign, an email campaign, which is an excellent way to get to people direct to consumer. We've also got some out of home. So what we mean by that are billboards. We've got collateral distribution via community outreach. And I want to make a special point there that we do have some great relationships with the food banks. I know that was a point of contention potentially on this call, and we will work to strengthen those relationships. Just for clarity there, we do have a relationship where we participated in a summer food drive that was a partnership between the CT Food Bank and Food Share that included 9 locations throughout Connecticut: Norwich, East Hartford, Norwalk, West Haven, Bristol, Putnam, Torrington, Bridgeport, and Winsted. And this was a food bank opportunity that didn't even require people to sign up. They could just come in and go. And the feedback that we received about that engagement was amazing. Folks, you know, of all different types of backgrounds were there. And so we know we are making some good connections, but there is opportunity to improve that. Thank you. And since I'm on that point of just some conversation points that we had earlier today, I wanted to let the folks know in terms of the unemployment benefit there, the Department of Labor is very protective of their database of information for the people that, you know, are on unemployment. And so we help supply them with language that they can put into their own communications via email and direct mail to let them, those folks know about the benefits. So not only are we marketing, but we're also helping to supply communications and materials to our partners so that they can push that out through their channels as well. So back here to the ARPA marketing, we've also got healthy chats. So these are actual in-person experiential events where people can come with their questions, get signed up right on the spot with our certified application counselors. And of course, we have webinars too, and that's where we kind of really engage with our brokers and those CAC communities. Down at the bottom, there is a Gantt chart here on the left-hand side. This is just a visual representation of the different types of advertising that we have in market and when throughout this special enrollment period. The different colors in orange don't really mean anything with one exception. There is darker orange in the TV category for the first 2 weeks of August. The rationality for that is that TV is incredibly expensive. And so we need to be very strategic about when and where we are during that time. Data and our historical knowledge shows us, and this isn't a big surprise to a lot of people on this call, I'm sure, but people procrastinate, right? If they know they have until a certain date, they're going to put it off for some time. And so we traditionally see a spike in the last week or two of any enrollment period. And so we're making sure that we're laying it on thick on that broadcast channel that reach those broadcast channels that reach a really wide net here in Connecticut during those last 2 weeks of the special enrollment period. So I'm gonna pause there, and then I'm gonna kind of transition into some information that we have about Covered Connecticut. I think that Vicki did a really great job. Thank you, kind of explaining what that program is in detail, just in case folks needed some information there. So over on the left side of the screen, just some language about what that program is. I think we've gone through that at length, but I wanted to just provide some numbers in terms of what we've seen so far. There are 570 folks that were immediately eligible for the Covered Connecticut program that were automatically enrolled. Additionally, there's 130 households and 179 individuals right now that need to make a change, right, if they want to be eligible. What are those changes? Just as Vicki said earlier, those changes could be maybe they bought up or down. Maybe they're in a gold or a bronze plan and they need to be in one of those eligible silver level plans. We've communicated to them that they need to make that change. Or perhaps they are not using the totality of the financial help available, whether that comes in the form of those advanced premium tax credits, the cost sharing amounts, and the new American Rescue Plan Act rates available to them. They need to be doing all of those things in order to be eligible. So we're communicating directly to those audience groups, letting them know what they need to do. And for clarity right now, just because I'm not sure that we really got there in our previous conversations, the only way for new folks to come in and enroll, and for those folks that need to make a change in order to be eligible for Covered Connecticut, they have to call the call center. This program was put together so quickly that we are still working to scale the system in order to have people go online and self-serve, which is why that mass media effort and what James was talking about, the potential to really crowd that call center, is particularly important right now. And that screen share that Vicki made with the calls to action, as well as the link with where people can find that on our website, which by the way is in English and in Spanish, as is needed. The call to action there is to call the call center. So all that information is in there, and I hope that that is useful to the folks on the call as you help us get information out into the communities that we serve. And then I'm gonna pull through some specificity as it relates to what we've done from a marketing and outreach effort specific to Covered Connecticut, and then I'll pass it over to John Carbone to talk a little bit more about SHOP, as I understand that there's some questions still related about our small business community as well. So in terms of Covered Connecticut, we've done a really great effort here to disseminate email and direct mail to those two first audiences, right? Those people that were immediately eligible, letting them know about the new benefit available to them, when they will be receiving their new insurance cards, right? And then auto-enrolling them. We've also disseminated that email and direct mail campaign to those folks that are so close to being eligible, they just need to make a change, letting them know that they need to do that and how to move forward. We do have a knowledge-based article up on our site. Again, that's just language. It's what Vicki shared with you in that link. It's in English and Spanish. Please use this information to get out to people. And that includes that full list of FAQs. So while Vicki did share some of the most relevant ones with this audience, there's a laundry list more that we hope is helpful to you and your constituents. And then of course, to help people get to that knowledge-based article that has the meat of the information, we've gone ahead and made updates to our website in several key areas that talk about the different opportunities to get financial help. People might be hearing our advertising about ARPA or Covered Connecticut and be searching to find information that way, or they could simply be coming to us not knowing what's available, and then we can give the information to them that way as well. So whether they know the program name or they just know they have a need, we're fulfilling that from both ends. Additionally, we've got some live social media posts. We hope that you engage with these and you share those out with your constituents as well. Also really important, hosting those broker and certified application counselor webinars. That's really penetrating some of those community partners, right, that we know are so critical in helping us make change for the communities that we serve. Additionally, we've got a flash alert, some inside jargon here, but those are the materials that we prepare and send over to our call center and our customer service representatives so that they know how to help these people that we need to reach and that could benefit from the programs. And again, because all of the help for Covered Connecticut needs to be filtered through that call center, that piece of material is really, really critical here. And of course, we are working to scale the system for new enrollees so that they can come in eventually and self-serve to get these benefits rather than having the call center. Not only is it a goal of ours at Access Health to work towards total self-service, but it is, a way that our customers prefer to engage. Many of them go online, do the research. So we are working to scale that up as soon as possible as well. All right, thank you for your attention. I'm going to go ahead and move into SHOP. I know that's a little bit of an abrupt pivot here, but I do want to make the most of our time and make sure we allow for questions and answers as appropriate. So I'll go ahead and pause and turn it over to you, John.
Thanks, Caroline. Good afternoon, everybody. Hope everybody's doing well. Some of you may know me, may not know me. My name is John Carbone. I'm the Director of SHOP and Product Development here at Access Health. Been here for about 7 years and in the SHOP Director role for a little over 2 years. Over the past 4 months, we've been extremely busy reaching out to our Connecticut small group and Connecticut employers and brokers and making them aware of all the additional programs and existing programs under the American Rescue Plan Act that have been available. We continue to do tons of webinars and social media events, and we continue to try to educate all our current and existing and new clients about everything that's available in the American Rescue Plan Act. As many of you know, there's an additional $52 billion in services that can't help but are not limited to just this list that I'm showing. But what we've been doing a little bit different since the inception is making our small businesses here in Connecticut, if you're in our bucket, not in our bucket, all Connecticut small businesses aware of the different types of programs that are available to them. So we've been educating them and going through the process, pointing them in the right direction, making aware of the rescue revitalization funds, the economic injury disaster loans, the payroll protection plan, which has been an incredible resource to small business here in the state of Connecticut. When the epidemic started a while back, we had a quick 30 to 35% drop off in the small group market. Once the payroll protection plan came into place, we ended up recouping all that and had an increase of additional 2-3% month over month on those programs. So as you can see, a lot of these programs have become in place. We have earned the trust of some clients that potentially wouldn't see the exchange as being an opportunity for them on the small group side and earn their business, because we made them aware of different types of programs, but also made them understand that we're here to help them regardless of if they're looking at an individual plan, a small group plan, or an off exchange plan. Because what we're looking at is we want to make sure that we follow our mission statement on lowering the uninsured rate and helping individuals understand the differences that are going on in the marketplace, and lowering the expectations of health disparities. So we're continuing to do that on a daily basis. With that said, we've been working feverishly to educate our brokers about the new programs under the American Rescue Act plan, also to make them aware of the new federal poverty levels, make them aware that yes, that new poverty, that subsidy cliff has disappeared, which created some great opportunities. Just to give you just in the past 3-4 months, we've moved total 42 groups already to the individual market, a little under 224 groups. We weren't tracking all the individuals that were coming to us that didn't have coverage under the exchange, but we made them aware how they can potentially structure their current programs that they have in place to save that employer some substantial dollars. A lot of individuals that are on this call have referred a lot of employer groups to us through Kathy, and we've been able to walk them through. So it is a little bit of a time-consuming process, because we're talking about an employer group who has a current benefit structure in place and teaching them something new that they're not used to, that they've just been doing the same thing for the past 25 to 30 years. So change kind of takes a little bit of time, and educating them and having them understand how they currently can use the American Rescue Plan Act as a resource for them, a recruiting tool, but also be able to feel like they're still giving a benefit to that employee. So one of the things that we're continuing to do through that process is making those brokers, which, as many of you know, the small group market, which is 50 and under, is heavily ran by brokers. Anywhere from 88 to 90% brokers drive this business, work with brokers. I feel like brokers are a great resource in this place, but there are other employers that fit outside of this bucket that also can benefit to the individual side under the American Rescue Plan Act. So one of the things is, Joe mentioned in the beginning of this, that feels that the small group bucket right now potentially may be in jeopardy or may have an issue. Well, give you kind of some statistics year over year. Year over year to date, July over July, we've grown over 33%. Since the American Rescue Act plan has come into place, we've grown over 8%. We continue to grow. As you see, we continue to grow as we're continuing to move members over into the individual side when it fits the need of that employer group. But there's still going to be individual members who are not going to be able to access any of these, subsidies, advanced premium tax credits. They just don't fit in that bucket. So there's still going to be a need for the small group side. And yes, we do not have a contribution structure or guidelines, but our average group does contribute 50% of the employee contribution. So with that being said, what we see the American Rescue Plan Act and the new subsidies we see as an additional tool in the tool belt for small businesses here in the state of Connecticut, but all businesses in the state of Connecticut. And we're going to continue to educate them through that process and make them aware of it. So, you know, to keep it kind of short, because I know we're running out of time, and I know we've gotten to a few questions. Joe, I don't know if that's answered your question or you have some additional ones. I'll be more than happy to answer them.
Oh, thank you very much, John. And John and I have worked together ever since SHOP was created. So it's nice to see you. Thank you.
Absolutely. We appreciate you, Joe.
All right, well, thank you for that presentation. I have a couple questions to Caroline on the marketing side. First, considering we knew there was going to be this ramp up, how many people were hired into the call center? New people?
To be honest with you, I'm not entirely sure about that, but I can certainly get back to you or pass that to James.
Sure, Resident Rep, the ramp up for the American Rescue Plan, our call center vendor had an additional 150 employees for the call center in anticipation of ARP.
Okay.
And I have to share with you, that's been a challenge to keep them. The marketplace is so fluid. The employee marketplace is so fluid. They are struggling to keep them. And right. they have increased their base pay to bring in front door within their training. The training period is 9 weeks to work in our call center, because our system, the process is so complicated. It takes 9 weeks for them to get comfortable with the information. Then 2 weeks after the 9 weeks, they get another job paying them more money. So it's a very competitive space out there, but they continue to have classes after classes. This year in particular, as we anticipate our 9th open enrollment, it's going to be a challenge. So they've asked us for more money, and because because we insist that they hire Connecticut residents to handle our customers. That's in our contract with them. That could be cheaper if we allow them to use people from Virginia, West Virginia, because they have call centers all over the country. But we insist that the money should stay in Connecticut, so we have to pay a little bit more because of that.
Okay, well, we appreciate that. Can Connecticut and Anthem do their own marketing?
Yes, they can, and they have.
Okay, so they can contribute, their dollars are also being contributed to your marketing budget. And
no, I'm sorry. No, we do coordinate marketing strategies with them, so that we don't overlap, but they don't give us any money.
Okay, and is that statutory that they can't?
We have not explored that, but if you remember, we do assess the marketplace for the individual market, since they're the only 2 players in the marketplace. So most likely, most of the assessment, they are paying for most of our budget through the assessment.
Right.
Right. So if there were if we ask them to additional dollars to augment our marketing, again, we coordinate everything we do in outreach and marketing. We coordinate very closely with both carriers.
Well, I think it might be something to explore, you know, because it is really a public-private partnership, and we're looking to drive as many people, you know, to this as possible. So I'll follow up on that.
We would explore that.
Yeah, and you know, James, I had asked you in January of, you know, this past year, how do we get more carriers on the exchange? You know, I really think we need more competition, which is going to help this process even more. I mean, you guys are doing great work. I'd like to see more options on the exchange. How can we help facilitate that?
So a couple of quick points about that. The only 2 carriers that sell individual insurance are on the exchange. Connecticut only has 2. Connecticut and Anthem. They're both on the exchange.
Well, I thought Harvard Pilgrim was in talks of coming on.
Well, we talked with them about it, but they pulled away. That was kept them very quietly, because right now they were just bought out by
tough, right?
About tough systems, and they felt at this point it's not a good time for them to come in right now. So we will revisit that with them next year.
Okay, and then lastly, there's a door-to-door vaccination campaign going on. Can we coordinate with that and also be signing people up, for, subsidized health insurance? Just throwing it out there.
So the vendor that that's doing the work for the public health with the door-to-door vaccination is our vendor. They work on Department of Public Health is working through us, through our vendor. So our vendor has been with us since 2013. So we offered them because we know how good they were. And while they are there, they are taking information about individuals that we could potentially sign up to outreach to.
Okay.
But that vendor works for us. We pay them, and the public health reimburses us.
Okay. Senator Lesser.
Yes, thank you, Madam Chair. And I have some sort of follow-up questions for Commissioner Schall. But before I get there, I just wanted to see if John would want to take the opportunity. I think Joe McDonough mentioned earlier some questions about SHOP's continued role in the environment of ARPA, and just wanted to see if you had any comments on that, and specifically as well, questions about the new not so new IRS rules about reimbursement of health expenses. Just trying to understand how we can best meet the needs of small employers, and whether or not the individual market may be the way to go. So, John, if you could weigh in on that.
Yeah, Senator, thanks for the question. I appreciate that. There are some different types of programs out there, as you guys know, which is the ICHRA, individual coverage health reimbursement accounts. I think what it is, it's just such a new product in the small group market segment. The technology hasn't caught up to it to make it become efficient or be able to be used as an accurate and efficient tool for the small businesses and the brokers. So do I see that changing over the next 1 to 2 years? Absolutely. We're keeping an eye on that and seeing how we can potentially participate in that market segment to see if it would be a great value for everybody. But the technology needs to catch up to it, because if you're just going to create additional paperwork for employers and brokers and the employees, it tends to bog down the whole entire process. We have individual groups that we deal with on a day-to-day basis that we potentially save them 6 to 8%, and they choose not to move because of the paperwork, or them having to move over to another carrier, and they feel that the unknown may be there. So as this stuff starts evolving and the technology starts becoming a little more user-friendly, I can see that the ICHRA programs could take off.
Great, thank you for that. I guess I'm still stuck at the larger sort of big picture level. And James, I heard you say earlier that the limiting factor, the reason you're not more out there promoting ARPA and Covered Connecticut, is because of the limiting factor of the small size of the call center. And I'm just having trouble understanding that because of I would assume, much larger volume you normally get annually for open enrollment. But I just want to make sure that I heard that correctly, as I think you said that a couple of times. And if so, I guess I'm frustrated by that, because the support that is available to consumers right now through August 15th is life-changing. I have spoken firsthand to constituents, to Connecticut residents who have had their lives changed. A middle-class family, I mentioned this earlier, they are saving $1,200 a month that they were otherwise paying. That is a life-changing amount of money for a middle-class family in Connecticut. And those supports are available right now for a couple weeks. Nobody knows about it. It's middle of the summer. People are not focused on insurance. People are, there's focus on the Delta variant. People are out of town. All sorts of things are happening. There have been very few outreach efforts that I've personally seen, and maybe I'm not targeted, I don't know. But Cover Connecticut has not been promoted at all. I think as folks have acknowledged to the wider public, and the ARPA funding has not gotten out there, and we are going to miss an opportunity to change people's lives if we can get that message out. So if the limiting issue is really the size of your call center, please give us the tools to fix that problem. If there are other things we need to do, let me know. It seems like extending open enrollment is the most obvious short-term thing that we can do, but anything that we can do to get this out there. I've heard of a lot of priorities today. James, you said earlier that one priority is expanding the number of brokers who are people of color. That sounds like an important and worthy goal. But that does not seem like the core short-term mission we got to do, which is to figure out how can we get people signed up between now and August 15th or whenever eligibility expires for ARPA and for Cover Connecticut, because these are life-changing programs that are going to completely transform people's lives if they know about it, but they don't know about it right now.
So, Senator, my comments about the call center I was referring, and also the mass media outreach, I was referring to Cover Connecticut. We are well prepared, well staffed in the call center for ARPA, because we knew that was coming. Our call center ramped up for it, and our call center normally is about 200 reps throughout the year. But doing open enrollment, they go up to between 400 and 450. After that, they go back down to a normal operating 200 and where they support Medicaid. But we ramped up by an additional 150 right after open enrollment ended earlier this year in preparation for ARPA. And so we are well staffed and prepared for ARPA. And I think you saw Caroline's marketing outreach that we've been doing since April for ARPA, and we're going to ramp it up in more TV ads, so forth. But all my comments about the mass media and the call center were referring to Cover Connecticut. So that happened so quickly. And we had to update our system. We had to do, even then, we did we did work with our call center to train them, but to hire additional call center reps and train them. Again, it's a 9-week process to train them to get them ready to use our system. There's just not enough time. And again, given we heard about this in late June, we started implementing in early July, and we are up and running now. The call center it's a 9-week process just to learn our system. And if they're not properly trained, they will make more mess for our customers than helpful. So that's the challenge is not our ability or willingness. The challenge was time. But as far as the American Rescue Plan is concerned, we have plenty of time to design a strategy and train our call center, hire new call centers. That's working fine for us. That's why the numbers that Rob went over meet the objectives. But the Cover Connecticut, that came out of nowhere, and we had to ramp up pretty quickly, and we're still ramping up to make it happen. As far as the extending the open enrollment, the special open enrollment, that we have to work with the federal government to make that happen, because they're on the hook for most of the costs. And again, I'm meeting with them Friday to get some clarity about that.
With respect, Mr. Vishal, I take issue with your comment that Cover Connecticut came out of nowhere. It was a bill that was introduced by the governor as one of his legislative priorities. It was received. We held hearings on it. There was a very publicized back and forth, at least with the insurance committee, went through the legislative process this year. I understand that it was only finalized at the end of the legislative session, like all legislation. I think the thing that's incredible is that our industry partners, who I generally take don't shy away from beating up on, stepped up and really did an extraordinary job of rolling this out much faster than I think we expected, and that was incredible. But it didn't come out of nowhere. I think the question we got to ask is, how can we get the word out, and how can we sign up people while that opportunity is important? And we're here to help. I think all of us are interested in supporting Access Health and making sure that this program succeeds. But it can't succeed if people don't know about it and if people don't have the opportunities.
My apologies, poor choice of word by saying it came out of nowhere. It's all relative. but we couldn't start doing anything until the law was final. And that didn't happen until mid to late June. And that's when we could start addressing the challenge of updating our system and doing the training we needed for our call center, as well as putting together a marketing campaign, which is what we've been doing. We have been doing everything we have done in the past to get the word out, doing targeted outreach, working with our community partners, which is the most effective way to get the population that we are doing out that we want to come in and take advantage of this. Now, we think there'll be some benefit when we start doing TV ads for the last first 2 weeks of August. I think there'll be some benefits to cover Connecticut efforts as well.
I'm going to ask one last question, and if I just for the record, could you detail in each category of eligibility, how many folks have you enrolled since the ARPA money became available as of today, as well as the Covered Connecticut program?
Sure. Hey, Rob, can you pull up your slide and go over the ARPA?
Can I just ask for clarification when you say eligibility category? Can you give me a little like what do you what are you referring to?
Well, you sort of slide earlier with people over 400% people in each different category. So if there are different types of different tranches of folks who are newly eligible for additional support under ARPA, and all through the. Well, I guess one question is about the special enrollment period. How many people you've been able to sign up there? Because some support has gone to people who are already enrolled, right?
Yeah.
So if you could just go through how's the special enrollment period working, and then how many newly enrolled people do you have, and then walk us through the specific elements of that slide.
Sure. So the special enrollment period, it's an expanded, so we always have a special, just for point of clarification, we always have a special enrollment period. If someone has the most common qualifying life event would be loss of coverage. If someone is no longer eligible for Husky, they can automatically transition. If someone loses their coverage to, let's say, an employer, they can come on and they have that as a qualifying life event. We currently have an expanded special enrollment period, which basically what that means is there's an additional qualifying life event, which essentially is a catch-all. If you are uninsured, underinsured, or you'd like to take advantage of the benefits from ARPA, that is your qualifying life event. There's no verification requirements. You don't need to provide any kind of documentation to us. Your coverage will begin the first of the following month. In that scenario, I think the question you had is how many individuals have we acquired since we've rolled out the ARP provisions? And I think if that's the question, the answer to that is we've enrolled about 9,400 enrollees. That accounts for about 10% of our in customer base or enrollment population. That the measurement of that started May 1st. That's when we essentially started implementing the ARP provisions. Let me pause there. Does that Representative, does that help answer your question, or would you like that broken out even further?
If you could break it out even further, that would be.
When you say break it out even further, you're referring to the FPL tranches?
Yeah.
Give me 1 second here.
Senator Lesser, after this meeting, we will summarize all this data and send it to the entire group. And if you have any follow-up questions, we'd be more than happy to answer and clarify anything for you as well.
Thank you.
So I can, yeah, we can certainly share it in detail. What I will say is I have a table in front of me where I've broken it out by FPL categories ranging from 0 all the way to over 700. Just to share some numbers with the groups, I'll just break it out into a high category for the purposes of saving time. Right now, 61% of the acquisition falls below the 400% level, and the remainder is above that 400% level. If there's any particular FPL groups that you guys would like to know what the proportion of that enrollment is within that particular FPL band, I can tell you right now. If not, we can certainly follow up with the table with that breakout.
And with respect to Covered Connecticut, how of the folks who have been enrolled, how many of them were already on the exchange versus how many are new enrolled?
So the Covered Connecticut program currently, when we rolled it out, the individuals who are currently enrolled and became immediately eligible for the Covered Connecticut program, that was about 570 enrollees. So over the course of one night, they immediately became eligible for the program and received benefits and information from us and the carriers regarding that program. In regards to the new acquisition, since we've rolled that program out, I don't have that data at my fingertips, but I could certainly, I can cut that for the team within about a day's notice.
So, excuse me, this is Vicky. Can I just chime in a second on the phone number situation? With respect to Covered Connecticut, we are giving out the call center number. We do want people who are not covered or need help or have questions to call the call center. The call center folks are ready to handle those calls. So I just want to make sure that's out there.
No, yeah,
And that
Vicky,
number was on a slide that was in a presentation that we can get around to people, and we also have notes on that.
Yeah, the phone number is, I think, included in that FAQ document that Caroline was also talking about, is the number for the call center people to reach. So just wanted to make sure people knew that. Just want to go back.
yeah, the number is 855-805-4325. That's the main number for the call center, 855-805-4325. Right. My comment about the call center was that if you have a mass media campaign going on, they will get inundated, but they're not staffed up. Because whenever you send out any information at all to the public, there's almost an immediate reaction into your call center. This is why DSS struggles when they send out information, and they don't have a call center. And it's when they get calls, and people wait hours after hours, and they hung up, and benefits do not materialize. So again, we are staffed up to support ARPA, but if we had another layer that weren't planned for, it could create an extraordinarily bad customer experience where customers actually lose faith in the system, and they don't call back. Then we wind up not helping anybody at all.
I'm sorry, I just don't understand that. And maybe I don't understand the way your call system works. And we spent a lot of time talking about the call system today, but if I call Access Health, you ask someone answers the phone, they walk me through a series of questions, and at the end of that, I get a quote for health insurance. Is that right?
Correct.
Okay. So I'm assuming that most people who are calling are folks who have not called since May 1st of 2021. So when the ARPA funds became available. So they're likely getting, whether they're eligible for Covered Connecticut or whether they're eligible for ARPA support, either way, they're going to get a heck of a good deal. They're going to get a very pleasant surprise when they realize how much more affordable health insurance they've gotten recently. So I guess I don't know where, I'm not sure who's the loser on that, right? If you're either eligible for ARPA support or you're eligible for Covered Connecticut, but either way, you stand to benefit from calling Access Health and checking your availability. You're going to get a much more affordable plan than whenever the last time you called Access Health. Am I missing?
No, you're absolutely right. That will happen. The question is this: is the call center staff up enough to support a mass media campaign? Most call centers are staffed up to match your marketing and outreach campaign. And they were prepared to handle the ARPA outreach effort since May. If we had another layer of mass media outreach, that gets really, they're just not prepared to do that. Now, if you call right now, whether you ARPA or you will get help, and you will get the benefit of either program. That's not an issue at all. The question is, if the most question is, they project how many calls are going to come in based on the outreach you're doing. That's how they staff up on a daily basis. And right now, they are staff up prepared to answer calls based on the campaign we shared with them that we're going to do to support ARPA.
Hey, James, this is Charlie Klippel. And I'm not new face to many of you. Let me introduce myself. I'm the chairman of the of Access Health, fairly new in that position. But let me see if I can connect a couple of dots here, because I think one thing, I don't think there's any disagreement here. I think the question is, we've got a great exchange and we've got a great program to cover Connecticut. Everybody's goal, I think, is to get the news out about Cover Connecticut to those people who are eligible for Cover Connecticut. If we can do that, they will call the exchange. They will get the coverage that they're entitled to. The question I think we're discussing is how to get that word out to the people who really will benefit from this program, and how to do it in a thoughtful way. And I think there's some good ideas that have come up in the conversation today. The exchange can certainly redouble its efforts with food banks, for example. The word is out with, I think, some critical players. I sit on the board of the Village for Children here in Hartford, for example, and they're well aware of the Cover Connecticut program. They serve individuals who are eligible for that program, and they share the word when those people come into their clinics. So I think it is out there. It's an interesting, somewhat challenging group to penetrate. That is the eligible people, and I think we really need to do it very intelligently. I think the number one thing that'll help is if we can push the deadline out, because we need to get the word into the communities that will benefit. And I don't really think it's a limitation in the call centers. I don't think that's the issue at all. I think it's just getting the news to the right people who are those that are eligible for this program. We could absolutely, all of us, benefit from a little more time on that. So I'm going to take for sure Representative Mesker's urge that we talk with our representatives in Washington to just push that along. I think we can get that done. And we will report back to the progress after Friday. But I think this turned, I think, a little bit into a conversation about call centers, which really isn't sort of the relevant issue. I do think it's a question of getting the words to the right people and making sure that they have the information to call. They know they will benefit from it. And that's really where the exchange has put a lot of its efforts, has put a lot of its resources with its community partners. We really appreciate the Vicki Veltry's office in helping with that. It's been super helpful. We can do more. We will continue to do more to just be targeted in those communications so that the right people get the right message and come into the program. It's a great program. It's one that the exchange fully supports. So we just need to make sure we are getting the communication out as efficiently and as clearly as we can.
Thank you. Representative Meskers.
Thank you, Charlie. I really appreciate. I was building a head of steam on the food banks. I was speaking from experience, and so I didn't want to hear it, and I'm not going to chew that up again. But when I say something, it's because I've gotten the feedback loop. Where I wanted to go in addition is being one of the newbies in 3 years in the legislature. It's obvious to me that every one of us is slavishly focused on our social media, our e-blasts, our client contact, our constituent relationships. So there would be a point of very strong weakness and criticism and suggestion. You give us the product that you're going to run in the media, in the videos on TV that you're spending money from, and watch us selflessly self-promote ourselves and the product you're trying to deliver. So you've got 151 representatives who look desperately to get reelected every 2 years. You've got senators who look to get elected every 2 years. Give us what you want us to push out to the constituent base for the renewals and for the use of this program. And this is a bipartisan effort. I mean, we're looking at a $7 million figure that Robert was giving us on a monthly basis which is $82 million of federal subsidies going into the state of Connecticut. If we can blast that number up, I'm going to do a dance in the middle of the Capitol. I mean, we want that money. We want to give people the health care. We want the subsidies into the state. So send us the information that you're putting out in e-blasts, in videos, expect it on our Facebooks and our emails. I don't think you've used us as shamelessly as you should. And
Amen.
Carolyn, I'm hoping you're hearing that loud and clear, Carolyn.
We will take
And you now have 161 more salespeople
exactly.
And personally, I will be the first in line to see the dance. So I'll see you there.
I think Representative Meskers hit that point very well. Representative Hughes.
First, I want to say thank God, Steve, I'm not going to be the only house dancer on the floor of the chamber. Echoing everything you said, this is for John. I would love to get the shop sort of resources out to our town's economic vitality commissions and chairs. All of our towns have these folks volunteering that are desperate for resources to point their people to. I love that slide that you had, but I didn't have any links or any of that kind of stuff. And I would love to get the shop sort of, resources out to our town's economic folks so that they can make sure that they're distributing what's available to the small businesses and options. Same kind of thing, only to our economic folks.
Not a problem, Representative. We actually have a deck that's created just for the American Rescue Plan Act that we do share and give a lot more detail. So I'll work with Kathy on making sure you get all that information.
And not just me, like Steve was saying, all 151 saying, here, this is coming from us, please send it out to your towns. Thanks.
So we will funnel all of this communication through Kathy, and then it'll get to everyone. Hopefully, blast it out to all corners of Connecticut.
Thank you for that, Representative Farrar.
Thank you, Representative Wood, and thanks everyone for being here. I've been listening intently for a couple hours now and just have a couple questions, I think, in reference to the Covered Connecticut program that I'm sure you all will be able to help with. So I think it was noted in response to Senator Lesser's question that there's been, if I'm right, 570 enrollees in Covered Connecticut. Is that accurate?
Rob?
That is correct.
Okay, awesome. Thanks, Rob. So kind of on the flip side of what Senator Lesser was asking for looking forward, understanding you all just started up this program, are there certain goals that you all have set kind of every month in regards to how many enrollees you're hoping to gain? I think just having that perspective of how you're thinking forward and what those goals might be could be helpful for us.
So Vicky, do you want to address this, Vicky?
Sure. So we've been meeting, I might get the frequency wrong, but maybe once a week, twice a week, or once every other week, as a team across the agencies to discuss who's still out there, how do we reach them? And we are actually talking about modeling right now because our model showed a level of uninsured of potentially up to 8,000 people.
Right.
We want to get them. I don't know that we've established monthly markers yet, but I think that wouldn't be a bad idea for us to set targets to try to reach each month, knowing that we're reaching a really small subset of the population. But I think it's possible for us to come up with those kinds of metrics moving forward. I don't know, James, what you think, but it seems reasonable for us to try to develop targets. I keep going to the high end because I want to get to the maximum number of enrollees. That's my goal.
Well, Vicky, I want to reemphasize our core mission is to lower the uninsured in Connecticut. That's what we exist for. Yeah. And that's what we will do everything we can to get there.
Right.
So Vicky, we'll work with you, Vicky, to come up with some target numbers.
Yep.
Monthly or quarterly numbers. And but again, we're gonna make them very realistic and shoot for them and then report back to this group
That's great. Yeah, I think that would be super helpful. And just hearing you acknowledge, Vicki, that because I agree with you, you can't model, to the one, right? I mean, you're working always with a range, but knowing that the range you're looking at is approximately 8K, just as we noted, we are all in this together, we want to be as helpful as possible. So if we can be reaching, any form of targets together, I think that just helps our cause. As we continue to advocate for a program like this in the future. I mean, that's only going to benefit us if we can show that. And then just one other quick question. I believe it was Caroline who mentioned that there was a point in time when the Covered Connecticut program would be available online. And I was curious what the time frame was around that.
I think Rob, you have a target date for that, Rob?
Yeah, sure. So the target date is October 1st. So we've been moving very quickly. Everything is implemented if the consumer comes in, we identify them and we put them in the program. But from an end user perspective, our target date is 10/1. And what that includes is a significant amount of development to make sure that notices are generated automatically for them, to make sure that that information is shared with the carrier in a standard format, to make sure that when the individuals evaluate their plan options, that they're seeing a plan that is essentially adjusted correctly for the Covered Connecticut program. And most importantly, that we are advising them and making sure that we're steering them into the requirements of the plan, which is the silver selection, 100% APTC selection. So our current roadmap is to have that ready before open enrollment. That'll be 10/1. That'll give us 30 days before open enrollment as well, to really start making sure we work any kind of bugs out, which should be limited. And at that point, during the open enrollment period, we'll be 100% ready for these folks as they start to evaluate options, and particularly for a big acquisition push.
Great, thank you, Rob. And again, I really welcomed the answers to both those questions and look forward to the follow-up as you all kind of narrow in on that modeling and targeting. I think that'd be helpful for all of us. So thank you, Representative Wood.
Thanks, Representative Michelle. I'm sorry, Rochelle. It's not Michelle.
Thank you, Rep Wood. And I want to thank the entire team for being on today to give us this update. I did have a couple questions. I've been poking around the Access Health CT website, and I remember when we had a meeting before this special enrollment period, and we were all so excited to bring these new savings to our residents, and I've appreciated the online forums that you've done with a lot of us. But I did notice that we haven't really had a lot of these short 30-second videos that explain to the public about this new savings, and even scrolling through the site, I couldn't find anything. And I do think, it's one thing to share a flyer, it's one thing to put a wall of text out, but I think it'd be really helpful for a lot of us in engaging with our residents. A lot of us have large email lists, a lot of us have, our social media. There's a value in having, a quick 20, 30-second video that explains that even if you have a plan, this is going to save you money. These types of little videos would be really helpful, I think. And so my hope is, I don't know if it's possible for, if we get something now before the deadline, and if not, when we're preparing for the open enrollment, I think that we really, as legislators, would like to be equipped with this so that we can do stronger outreach with our residents.
Yeah, so let me chime in on that a little bit here. I think that our TV spots could be really helpful in rendering across platforms, and we can definitely make those available for you so you can pull those through in whatever dissemination channels you have from a digital capacity, right, where video would be relevant. So that's a quick solve, at least from the American Rescue Plan Act perspective. And video and TV spots are always a part of the, the plans that we make when we have the advance notice, right? When we can have that creative brief, when we can work with our creative partners to get that messaging done. There's a fair bit of production, it's costly and time consuming. That said, we've got it for the American Rescue Plan Act. We're going to have that for open enrollment. And so we'll make sure that you can regularly get that information. And we also do share that out on our social media pages too. I will say we have very robust social, so that might be why as you're scrolling through, it's hard to find, just because right now we're regularly putting out content about it. So we'll make sure that you get that video content if you find that to be particularly helpful and digestible for your constituents, not a problem. And we will keep you abreast of the development of video assets as well as creative assets across the board that are useful for you to share out as well. We'll definitely make sure to keep you posted on that, not a problem.
Okay, thank you. I just think, you know, for getting it to our community partners, it's, you know, a flyer is one thing, but really for a lot of residents, that first 20, 30 seconds of a video will go a lot further and be much more memorable for folks. And it's a lot easier to have, you know, folks will share that more. So if we're working to get the word out. And then also, are you guys doing paid advertising and targeting communities that are lagging behind on enrollment? Are you doing anything along those lines for social platforms?
There's a huge advertising campaign and market to support the American Rescue Plan Act. It's a $1.4 million plan that does include broadcast channels. So that digital asset, right? Those videos are on TV, it's on radio, it's also on streaming. In terms of Covered Connecticut, we don't have an attached budget to support that kind of outreach at this point in time. That doesn't mean that we're going to not share that message out there. We have a huge opportunity to tie in the Covered Connecticut benefit as we're developing our open enrollment materials. And so that kind of, you know, what's available to people during this open enrollment period is that extension of ARPA as well as Covered Connecticut. So we're going to be building that in to those assets. So it's coming in terms of Covered Connecticut, if that's what you're getting at there.
How much are you spending on digital versus television? Because, you know, in this modern time, there's a lot of folks that just simply don't have TV or can't afford TV or just use, you know, Hulu and Netflix and things along those lines now. So there's an entire demographic that has been jettisoning like typical television. What are we doing to make sure we're reaching them?
So our broadcast buys, so TV, that encompasses OTT. So that over the top are those streaming devices. The Hulu's, the Netflix, that's included. Our digital, we're always, you know, making sure that we're working with our media partners that have access to Nielsen data, amongst others, that tell us what are the demographics in our state. And as that changes year by year, to make sure that we're allocating our spends appropriately. So we have a healthy digital buy. And the reason why we're not, you know, as strong, and especially in that broadcast TV until the last 2 weeks, is because we know that, right? Not only is it more expensive and people procrastinate, but we're not going to put that much money across the board for the entire time when it doesn't make sense because of your point. So yes, we have a very healthy digital spend to supplement, you know, the rest of the media that we're using and recognizing the changing consumer habits.
Okay, I appreciate that. And then if you can just get us those videos that you're running on TV, I think you'd all be very appreciative to have those to be able to push out to our networks and make sure that it's saturating where we can get it saturated to.
Not a problem.
Thank you.
All right. Any final questions or comments before we go? All right, I want to thank everyone for coming in the middle of summer. This was meant to, you know, really get the word out that we have an enrollment period that is closing, and hopefully that won't be the case. I think that's one of the takeaways here is to see if we can extend that. Please use us in the legislature to help get the word out. And I hope that we can continue with some follow-up, you know, in a couple weeks, and again, you know, shortly thereafter. So I want to thank the Access Health CT team, Vicki Veltri at OHS, and Joe McDonough from McDonough Insurance. This was really great, very helpful, and let's continue to do some good work. Thank you to Kathy Abercrombie, the chair of the Human Services Committee, for working together on this, and let's get the word out.
Thank you all very much.
Thank you so much.
Thank you.
Thank you, everyone.
Thank you all.